Collaboration and teamwork. Client safety, quality of care, and healthcare outcomes are greatly improved through the use of collaboration and teamwork. Nurses' thoughts and opinions are highly valued by healthcare team members because of the positivity nurses have on their individuals' or clients' outcomes. The use of collaboration and interprofessional teams has been noted to produce various benefits for client safety and care. Many healthcare professionals are educated only in their own specific profession, and this can lead to a lack of understanding and can cause fragmented care for our patient population. The interprofessional healthcare team needs to collaborate, combine their resources, and develop plans of care that are based on the client's own specific needs. A consultation or consult note is when one healthcare provider requests another healthcare provider's input or advice on treating a specific condition. When a healthcare provider refers a client or requests a referral, the provider is delegating the responsibility to another healthcare provider. Consultation and referrals are part of the collaborative process because no single team member possesses all the necessary knowledge and skills, as well as answers. Communication is seen as an exchange of information. Interprofessional communication occurs in real time with all team members present at the bedside, or it can occur through written documents. Discharge planning begins upon the admission of an individual to a healthcare facility, and this requires information from the entire interprofessional team as well as the client or their proxy. Effective discharge planning will decrease the length of an individual's stay, avoids their readmission, decreases their healthcare costs, and then increases the facility's reimbursement for care. On the day of discharge, the individual must be given written discharge summary that includes step-by-step instructions on how any specific procedure, for example, a dressing change, may need to be performed, the medications they need to take, their diet, any follow-up appointments with a provider, or any complications that they may need to monitor for, and then when to notify that healthcare provider. The discharge summary will also include any level of activity or restrictions that have been placed on the client. Communication with members of the healthcare team should be closed loop, continuous, and collaborative. This is a form of communication that is vital for safety of the healthcare environment and for the clientele. Closed-loop communication is the use of standardized terminology and procedures to help ensure that messages are received, clarified, and then correctly interpreted. Handing off of care from one provider to another is often a time that may be prone to an error. There needs to be clear, accurate, and concise information that is transferred from one team member to another without any interruptions, language barriers, any hurried activity, or intimidation. Standardized communication and handoff tools will lead to positive results among healthcare providers. The SBAR communication stands for Introduction, Situation, Background, Assessment, recommendation, and readback. Standardized communication has positive effects in client outcomes. Through utilizing the SBAR, this provides a thorough exchange of information, decreases communication breakdown between providers, minimizes medical errors, and helps to ensure safety for staff and for the client. Receiving providers' prescriptions, verifying or reading back information, and documenting information correctly is vital to safe care. When receiving a prescription on a phone or a telephone prescription or a face-to-face interaction, the nurse must ensure that they write all parts of the prescription and then transcribe it into the permanent document. For example, the electronic medical record or the health record. When transcribing, the provider's full name and title should be recorded, the date and time of the prescription, and the full prescription written out without any abbreviation. The Joint Commission's provision of care, treatment, and services requirement states that the receiver of a verbal prescription must read back an order as it has been written to verify it was heard and transcribed correctly. Medication reconciliation or verification. This occurs when the client is admitted, discharged, or transferred from one unit, facility, or institution to another unit, facility, or institution. The nurse will gather a complete list of medications, then reconcile and verify the list accuracy, and documents all the medications the client needs while they are within the healthcare setting. Medication errors often occur during any phase of prescribing, transcribing, dispensing, administrating, or documenting cycle. Verbal prescriptions are extremely vulnerable to being misunderstood, miswritten, or misinterpreted, especially during the initial communication of the prescription or when the prescription is rewritten or transcribed into the medical administration record. Medical errors can also include commission and omission. Commission errors occur when the nurse takes the wrong action. An example would be wearing latex gloves to perform a procedure for an individual that has a documented latex allergy. Omission errors occur when the nurse is not taking an action. For example, not locking the wheels of the bed during the individual's transfer. There are various competencies to help develop teamwork and collaboration. One is the values and ethics. These require mutual respect. The values should be shared, and there should be shared decision-making. For roles and responsibilities, every medical individual should recognize the scope of practice of various medical professionals in order to address the client's needs. Interprofessional communication is communication with clients and other professionals in the medical field that contribute to the client's care. Teams and teamwork is the use of relationship-building principles to effectively deliver safe, timely, and efficient client-centered care. When thinking about developing teamwork and collaboration, it has been known that incivility, lateral violence, and/or bullying may occur within the healthcare practice. Nurses are guided by federal, state, and specialty professional nursing organizations. These institutions develop standards of care and scopes of practice. The American Nurses Association's Code of Ethics for Nurses and Interpretive Statements is a fundamental document that describes how nurturing professionals should interact and collaborate. The American Nurses Association describes incivility as gossiping, spreading rumors, being rude or discourteous, or simply refusing to help a coworker. Bullying is viewed as recurring behavior that involves an unwelcome action that is intended to cause harm, humiliate, or distress another individual. Incivility can become bullying through repeated harmful actions. In the healthcare environment, it is a nurse's duty to provide a safe and satisfying work environment because it is vital to interprofessional collaboration, reducing medical errors, decreasing staff turnover, and increasing the quality of care and outcome for the health care that is provided. Emotional intelligence is considered a framework or a technique. This is used to narrow any emotional gaps, enhance positive behaviors, and assist in easier adjustments to the ebb and flow of professional life. Being emotionally intelligent is when an individual has mindfulness and consciousness of feelings or emotions that affect their actions, decisions, or critical thinking. Self-awareness, self-regulation, motivation, empathy, and social skills are major elements that help determine one's emotional intelligence.